Well, I'm here with Dr. DiGirolamo from Caserta, Italy. I'm very pleased that we can meet here and have a little interview. Dr. DiGirolamo has been working with us from the very early beginning. He is an expert user. He did his cases also on the Sundays all by himself, gloves on, glove off, and has been showing us all the possibilities and what we should do and not do, also in terms of user interface and so on. So it's really a pleasure to have you here on this particular pleasure to have you on this particular interview. So you are one of those early users.
Yeah.
Are you using it now on a daily basis, or are you waiting for certification or improvements? Certifications in Italy or from the hospital. Where are you now with the QFR?
No, we are using it on a daily basis. We have no need for certification because the software is CE approved, so we have no problem to use it every day. And I think we use it in a couple of cases every day, so it's very important to do that. And the problem is to make the people, the operator, approaching the patient, taking in mind that they want to make not a simple angiography, but something that can be used to functional evaluation.
Yeah, that's indeed the issue. Of course, that is why we have those training sessions. It is not just two simple angiograms, but you have to spend some time and your thought with it so that you get the good views, good quality, and particularly for the frame count also sufficient high frame speed, and also the brisk injection.
Brisk injection, yeah.
Is very important. And
it's the same that having a good geography, but what we do, it's follow your recommendations for the views, the projections, the views, because it's important to make the correct views or to use the acquisition guide. That's very useful in some cases. And so we found that we improved our angiograms too, not only the functional evaluation, but we make better angiography.
Well, that is what I hear often. Once you know that it is used for the QCA, 3D QCA or QFR, that people start to make better angiograms.
Yeah.
I learned that also from other sites in the Netherlands, where they say, yeah, we made those angiograms, but now if we make them with the attention, we follow also an improved protocol and make better quality images.
Yeah.
And that is thanks to those extra information that you get.
We have extra information because we use some views that we never used before, and we found them very useful in some cases. And the 3D reconstruction is very attractive because we use it for stand sizing and to plan the stand when we have a multi-lesion patient, multi-lesion the same artery, avoiding to make a full metal jacket, but guided by the functional evaluation, we tend to treat only the lesions that are functionally significant. So we save time, save money, and I think that we make a better job for the patient.
Yeah, no, that's of course very happy to hear. That is always the intention of our software. As you know, we have been doing QCA for a long time, but this really is a different ballpark. We need to be there at the table when the patient is on the table and need to be treated, and that's when the decision has to be taken. And it's quite different from the regular QCA, and that is also very interesting for us because it's really a medical device, and that makes us also realize that we have to spend time on the user interface, on the simplicity of the approach. We learned from you also how we can further simplify a number of steps, and that's what we need to do.
Yeah, I think that the software is good, but it needs to be refined for the user interface, because the interventional cardiologist is a strange type of animal. He don't want to lose time, so he want to go directly to the target. So I think that he needs something that's very simple to approach, and simple and repeatable and easily done by nurse, by technicians, because And I think that in this form, many steps were done to improve the interface. I think others must be done.
Yeah, of
but
course.
The way is correct, the way is right.
And at a certain point in time, of course, we like to have it at the table, and maybe with a touch screen, so that you can do it just in a couple of clicks. And that is really our ultimate goal. But for that, we need to do some AI, as they call it, artificial intelligence, big data to recognize proper views, to do the frame counting more automated. And then it becomes more and more clinically applicable.
Yes, because the key factor is a good angiogram. Because if you have a good angiogram, the user interaction is very, very small, because everything is done by the software. So that's the key factor to have a good QCA and a good QFR.
Yeah, no, absolutely. And so you contributed quite a bit to you have been involved with all the studies, the FAVOR 2 study, but also studies in Italy, and you have helped us and Gennaro also tremendously getting the Italian doctors really enthusiastic for the approach. So we really thank you very much for all of that.
Thank you to
and
you.
You travel to Russia and other countries.
Yes.
And very soon we will also start the FAVOR 3 outcome study. So we also hope that you will participate also with.
Of course, we will participate with pleasure, because we will see what if the QFR is able, like the FFR, to give us information about the outcome.
Yeah, no, absolutely.
I think it's a big step forward.
Yeah. Now we very much look forward to that, and maybe in a year we are not really we don't have all the results from the FAVOR 3 study next year here, but at least we will have hopefully all the 2,000 patients included, and maybe see already a glimpse of how these things will work out in the future.
Yeah.
And also with all the other studies that are being carried out in Italy, because Italy is really very driving also.
What we are involved in is a study on non-culprit lesion in acute MI. I think that's a very interesting field of interest for the QFR.
Yeah.
And I think that is another field that must be addressed. And I know that Green Caserta and Professor Campo and Ferrara are working on this, and I think it's a very interesting field.
Yeah, absolutely. Well, I'd like to thank you very much for your time to be here for the interview, and we look forward to have more discussions with you in the very near future.
Of course.
Thank you so much.
Thank